Welcome to Vital Signs, smart, science-first health guidance for real life. If you're over 60, here's a truth most people never hear until it's too late. The outcome of a heart attack is decided long before a doctor touches your chart. It's decided in the first minutes in a living room, kitchen, or elevator when blood flow to the heart suddenly drops and panic tries to take over. Half of the danger is the clock. The other half is hesitation. The people who survive aren't necessarily the strongest. They're the ones who act first and act right. When the pressure clamps down across your chest, when a wave of breathlessness or a cold, sudden sweat hits, you don't take a survey of possibilities. You treat it as a heart attack until proven otherwise. This is the moment you pick up the phone and call emergency services, not in 5 minutes, not after sitting down to see if it passes. Now. Paramedics can begin treatment the second they reach you and can route you directly to a cardiac-capable hospital where minutes translate into living muscle. Every delay is paid for by your heart cells, and they don't grow back. Call first. Everything else comes second. That single choice keeps you inside the window where modern cardiology works best. Once you've made that call, stack the odds further in your favor by making your home easy to enter and your line open. If you can safely move a few steps without strain, unlock the front door now. If you can't, ask the dispatcher to alert responders about the lock or building code. Keep your phone within reach, and, if you feel weak, switch to speaker so you can talk hands-free while conserving energy. You're clearing barriers that cost minutes. Minutes your heart can't spare. You've turned chaos into a plan. Help has a straight path to you, and you remain connected the entire time. Next, position buys you breath. Sit rather than lie flat. Prefer a chair or the edge of a bed with your back supported. Loosen anything tight around your neck or waist. This simple posture change reduces pressure on your lungs and lets your diaphragm work with you, not against you. In a heart attack, your body is juggling low supply and high demand. By sitting upright and relaxing your shoulders, you lower the workload just enough to steady the system and help oxygen move where it's needed most. Stillness is strength here. Every unnecessary step is an extra invoice to a heart already on credit. If you've been prescribed nitroglycerin for known coronary disease, use it exactly the way your clinician taught you while you wait for EMS. This is not the time to borrow medications or experiment. Follow the dose, respect the spacing, and tell the dispatcher what you've taken. And if a professional has advised you in advance, or the emergency operator instructs you to take aspirin and you're not allergic, chew it rather than swallowing whole. Chewing exposes more surface area, so it gets to work faster against platelets that are trying to thicken and block flow. None of this replaces emergency care. It bridges you to it. And note the order. You already called for help first. Your breathing is more than air, it's control. Panic pumps out adrenaline that hardens your heartbeat and spikes pressure. Counter it with slow, deliberate breaths. Inhale through your nose and feel your belly rise under your hand. Purse your lips and let the air out gently, as if blowing through a straw. Keep your eyes open if you need the focus, or close them if that helps you release tension. 6 to 8 breaths a minute is a good target, calm but not forced. This pattern doesn't cure a blocked artery, but it lowers the body's demand while you wait, saving the energy for the moment it truly counts. Tell yourself, out loud if you like, help is on the way. My job is to stay still and breathe. You are buying time the modern way, on purpose. Let's pause on a viral trick that refuses to die. Cough CPR. You may have seen the claim that hard coughing every few seconds can stop a heart attack. Here's the clearest way to understand it. CPR is for cardiac arrest, when the heart stops and you are unconscious. If you're conscious enough to cough, you're not in cardiac arrest. There is a narrow hospital-only scenario where forceful coughing might briefly help a monitored patient with a specific arrhythmia, while a clinician is literally watching the rhythm on a screen and preparing a shock. That's not a living room heart attack, and it's not a substitute for calling emergency services. The American Heart Association does not endorse cough CPR for the public. Your safest plan is exactly what you've already done. Call, open access, sit still, breathe, and follow professional instructions. 2 important don'ts protect you from well-intended mistakes. Don't drive yourself. An arrhythmia or drop in blood pressure can turn a steering wheel into a lethal risk. If there's absolutely no way to get an ambulance, have another adult drive you and keep the dispatcher on the line guiding you until you're in medical hands. And don't try to walk it off. Movement demands oxygen. Your heart can't deliver right now. Pacing the room is like flooring the gas with a blocked fuel line. Sit, rest, breathe, and let the team come to you. Here's why your first minutes matter so much. Modern heart attack care is a race to reopen blood flow, rapid antiplatelet therapy, rapid assessment, and often a quick trip to a cath lab where a cardiologist threads a stent into the blocked artery. That's how people go from crushing pain to relief in under an hour, but only if they reach the right place in time. Survive the living room, and the hospital can save the muscle. Miss those minutes, and even perfect hospital care arrives to a battlefield already lost. Knowing the steps gives you leverage over bad timing. Quick check. Do you keep a small, non-enteric aspirin within easy reach at home? And do you know if you're allergic? If your clinician has said it's appropriate for you, store it where you can reach it without standing, and make sure family members know where it is. If you already have a heart plan, tape it inside a cabinet door or near the phone. If you don't, ask your doctor at your next visit to clarify exactly what to do, including whether aspirin is advised for you personally. That one conversation turns fear into a checklist. While you wait for help, think in simple loops. Check your position. Upright, supported, shoulders soft. Check your access. Door open, phone on speaker, address visible, or shared with the dispatcher. Check your breath. Slow draw in, gentle release out. If you have nitroglycerin prescribed, follow the instructions you were given. If a professional has told you to take aspirin and you are not allergic, chew it. Then repeat the loop. This rhythm, position, access, breath, follow instructions, is a way to stay busy without moving, to stay focused without fighting yourself. You are not trying to be a hero. You are trying to arrive alive. Tell me in the comments, which step surprised you the most? People often say it's the door, such a small detail that removes a huge barrier. Others say it's the myth-busting, because they had placed faith in coughing they saw online. The truth is simpler, quieter, and much more reliable. Stillness, access, breathing, and professional help. Fast. If you're supporting an older parent or you live alone, set up your environment now. Put a house code on file with a trusted neighbor. Make your address and building instructions easy to read from the doorway. Keep a charged phone at arm's length in the spots you sit most. If you've been prescribed nitroglycerin, keep it where you can get to it without standing. If a clinician has advised aspirin for suspected heart attack, in your case, store a non-enteric tablet within reach. Otherwise, leave it in the cabinet and wait for EMS guidance. Preparation makes good decisions happen automatically when your mind is noisy. And when the siren arrives, accept the help. Tell the crew exactly what you felt, what you took, and when the symptoms started. The timestamp matters. It guides decisions in the ER and cath lab. Once you're through the acute phase, you'll hear about the next chapter: cardiac rehab, medications to prevent clots and quiet inflammation, blood pressure targets, and the food, movement, and sleep patterns that help your arteries heal. Surviving today gives you access to those wins tomorrow. Before we wrap, here's your pocket plan to rehearse once, then tape to the fridge. Chest pressure or breathless cold sweat? Call emergency services. Unlock door. Sit upright. Phone on speaker. Breathe slowly. Take only the meds I'm prescribed, and aspirin only if a pro tells me to. And I'm not allergic. Stay still. Wait for help. Read it once a month. Share it with the people who love you. Where are you watching from? And does your home have an easy entry plan for paramedics? Drop a note below. Your setup idea might save someone else. If this helped you, pass it to one person who could use a calm, clear plan. And if you want more practical, science-first guides like this, you're in the right place. Stay ready, stay steady, and remember, the first minutes belong to you. Use them well.